And I hear you've been having some kind of like a lot of bleeding. Okay. And that's to, do you remember who that surgery is with?
Not Nanja.
Who is it?
Dr. Nanja.
Nanja? Okay.
UCSF.
Oh, UCSF. Okay, gotcha. All right. Okay, yeah, I see here. You're saying, okay. Okay, let me see here. Okay. Okay. And so have they told you kind of about what the procedure is like?
I think she tried to do it for me without any
Okay.
anesthetic. So I guess the same thing she did now, just with an anesthetic.
Yeah. And so that's going to be oral, right? Do you remember? No? Okay. And was it for like a medical procedure?
Yeah, after I had it's like something done. Okay. It's been a long time.
Okay. Gotcha. And then you're saying that it didn't really help with the pain, but just made you sleepy?
It kind of made me sleepy.
Okay.
I'll try it though.
Okay. Do you want to try it today?
Yeah, I'll try it still.
Okay, got it. I think, do you have, I don't think you need a ride, but is someone going to pick you up after, or you?
Yeah, I thought I was, they thought they was giving me sedation, so I had someone drop me off and somebody's picking me up.
Okay, gotcha. Okay, got it. I'm glad to hear that. You definitely want to make sure someone's here to, take care of you after.
Well, I gotta take care of myself, but at least I got a ride home.
Okay, yeah, at least you have a ride, so that's good. I know life can be lonely out there. And I see here that you take Suboxone or Bupe?
Yeah.
Okay. And is that for?
It's for my pain, but I don't take it that much because I don't like the way it make me sleepy too.
Okay. How often do you think you take the Suboxone? Like every day?
Mm-mm.
Okay.
Like maybe. Well, I ain't supposed to tell you this because then my doctor ain't gonna want to prescribe it to me no more, because he think I take it every day.
Oh, okay.
But I don't like the way it make me sleepy.
You take it occasionally?
Yeah.
Okay.
Don't put that on there, please.
Okay. You want me to not put that you take it?
No, don't take that. Don't put that. Just put that I take it, but don't put the frequency.
Okay, gotcha. Can I say it makes you sleepy?
Yeah.
Okay, gotcha. Makes you sleepy. Okay. Alright, that's what I put there.
Okay, it's all good. I trust you.
Okay, cool. Okay. And do you feel like when, because sometimes folks that are, have had a lot of pain or chronic pain in their life and take like Suboxone or other like opioids for pain, sometimes they need more during procedures?
That's probably what it is, because I'm already in a lot of pain. Okay. That's probably why I feel like they don't do nothing for me.
Okay, gotcha.
Because I'm in so much pain already. And I don't take nothing for pain, so.
Okay. You don't take anything for pain?
Motrin,
that's it. Okay.
Yeah. I don't like the way they make me sleepy. Yeah. I don't like the way drugs feel.
Okay. And did you take any medications this morning?
I took some Motrin at about 2. It was maybe 3. It was 3, 2:52.
Like AM?
Yeah, I'll be up all night hurting. So I couldn't remember if I took it at 3 or 5. I took it at 3, 2:52.
You weren't able to fall asleep last night?
I don't sleep mostly no nights.
Okay. Where do you live?
In San Leandro, by the marina.
Okay, gotcha. Okay. Gotcha. So in terms of the procedure today, it's kind of like a pap smear, but a little bit longer, with a little bit more discomfort. And so hopefully with the Norco, we can avoid some.
Do you at least put some lidocaine?
We can.
Okay, that'll help if you could at least use some lidocaine.
Has that worked in the past for you?
It works when I do my oral surgeries and stuff. So
yeah, I think that shouldn't be a problem. I can tell Dr. Lee we can put some of that. It might just it's a little sting at the beginning, but then hopefully better after. Yeah. So we'll place a speculum, kind of like for a pap smear. Look at the area, look at the cervix, and then basically go inside the uterus and kind of suction some of the what's inside the uterus out, some of that tissue. And then that we'll send that to the lab. They can look at it and see if there's
How long do it take to come back to see if it's benign?
Yeah, so it typically takes around maybe like 1 to 2 weeks to get the result.
So before I have surgery, it should be back.
Yeah, and I don't think your surgery I don't think would be able to go without it.
No, I can't. That's why I had to get this done.
Yeah. And so if there's anything really abnormal, we would give you a call and let you know. And then otherwise, you would just do kind of a follow-up later. And you can get the results on my chart, or your other doctors at UCSF would be able to see the results too.
Okay.
So they have access to all of this as well.
Okay.
What questions do you have?
That was the main one.
Okay.
And then, do y'all send me home with some medicine then? Pain medicine?
Yeah. So typically with this, the main thing that we give, the thing that works the best is honestly ibuprofen. Because you might just have some cramping afterwards. Okay,
so for a couple of days?
We say like 1 to 3 days. Hopefully only 1 day, right? But sometimes it's a little bit longer. It just depends on the person. But you can take ibuprofen like 600 milligrams every 8 hours, right? So you just have it around the clock for the first couple of days, just in case. And that should really help. And if you take it every 8 hours, that prevents the pain from coming, right? So
from letting it roll back up.
Exactly. So, as with any kind of procedure that we do, there's always a risk of infection, of bleeding, right, and damage to other areas. You all right?
I'm just hurting.
You're in pain, right? Okay, I'm sorry. We'll just kind of go through this consent, okay?
Mm-hmm.
And so for infection, we make sure that we minimize that by making sure
go to the ER.
Go to the ER, okay? If you feel like if you're having a lot of bleeding, like you're going through more than one pad in 1 hour, go to the ER.
I'm gonna be bleeding too?
Just like some spotting. So it should be minimal, but we're just giving you some just some guidance so that if you see more bleeding, you will be able to know what to do. But we don't expect you to be bleeding more than just like a little bit of spotting.
Okay.
And then those are kind of the main things. We already went over when you get the results.
Yeah.
Okay, gotcha. So that's kind of it.
So is Dr. Lee already here, or we waited?
Yes, Dr. Lee's right here, so we're just gonna sign this consent, give you the oral medication, and then we'll begin. The medication will take maybe like around 20 minutes to kick in, so we have to just wait for that. Okay.
Mm-hmm.
Okay. So let me just. This is. So I don't think that we're going to give you like Ativan or anything. We're just going to give you the Norco for the pain.
Mm-hmm.
Okay. And you want to take that, right?
Mm-hmm.
Okay. So you're in a lot of pain right now. Huh?
Mm-hmm.
Okay. Is the pain like in your back?
Right.
Okay.
I got a hot pack
Okay. Okay. You have a pretty chronic pelvic pain, right?
Yeah, because I got a big tumor in my left ovary.
Okay.
Yeah.
And that's what they're going to be getting rid of?
Mm-hmm.
So this consent basically, let me just make sure everything's right. Okay. This consent basically says that we've talked about kind of the risk of the procedure, the benefits of the procedure, which is that we can find out if there's any cancer, get you prepped for that surgery. We talked about the risk of infection and bleeding and pain. And I've answered your questions. You can always ask more questions. Here is where you would sign. So I'll give you this.
Can I get some another one of these?
Okay. I'll give you that once we're done signing. Is that right?
Thank you.
Okay, great. And then I'll sign here. And then once you got that one, we can get started. Okay.
Mm-hmm. Okay. One more, you said? Oh, that's it?
Oh, that's it. This is just for me. So I'll sign that. We have them here, but I know they have them outside too, so I can get them. I'll get them outside. I'll bring one in for you, okay?
All right.
I'll get one outside and I'll bring one in.
Okay. After you give me the medicine, I'll take off and sit over there.
Okay.
Do you have a gown for me? Or
yeah. The nurse will come in and we'll give you kind of the gown.
the paper or a gown? Is it the paper or a gown?
No, I think it's made out of like
the cloth. The paper. Okay.
Yeah, I don't think it's like. I think it's like cloth.
Okay.
And we'll give you a blanket and all that too.
Okay. Y'all got a warm blanket?
Yeah, I think so. Yeah.
They're trying to give me some pain medicine. They try to do this shit. No pain medicine. Damn. Them little hospital juices be here. So. Y'all ain't cool. Y'all don't even say nothing. Y'all can look at the wall and I'll get y'all. Y'all ain't talking to me. Since y'all ain't talking to me, I ain't talking to y'all. I'm finna turn this on and go post.
Okay. All right. So this, I was actually mistaken in that we are going to give you. So it's called Ativan. Have you had it before?
Yeah. I usually take it with my pain medicine.
Okay, gotcha. Yeah. Great. So we're going to give that to you, and that would make you, a bit sleepy. Sorry. So that'll take about 20 minutes, and then we'll get started. Okay.
Mm-hmm. All right. 20 minutes. It's cold in here, bro. Y'all got about 5 more minutes to just stare at me. I'm finna turn this shit off. I hate y'all. Y'all just come stare at motherfuckers.